Welcome back to my YouTube channel, and we are currently doing with vital signs, and part 1 and part 2 have already been uploaded. Do visit for better understanding, and hope you all are doing well. So let's start with vital signs. So according to INC syllabus we are doing it. So guidelines for taking vital signs: body temperature definition and assessment, temperature alteration, fever definition, causes, stages, types have already been done, and hot application, cold application also we have done in part 2. Do visit that lecture for better understanding. So we are starting with pulse. So now let's start with pulse. So pulse is defined as the rhythmic expansion and contraction of the artery that occur as a result of pumping action of particularly the left ventricle when ejects blood into the aorta and arterial system. So if in simple words we say, pulse is the pressure वेव फेल्ट एट द आर्टरी ड्यू टू द हार्ट बीट. प्रेशर पल्स वो प्रेशर होता है कि जो जो हम फील करते हैं आर्टरीज पे ड्यू टू अ हार्ट बीट. और वी कैन से पल्स इज द रिथमिक एक्सपेंशन यू नो एंड कॉन्ट्रैक्शन मीन्स बिकमिंग टाइट ऑफ द आर्टरी दैट अकर एज द रिजल्ट ऑफ पंपिंग एक्शन ऑफ द हार्ट. व्हेन आवर हार्ट पंप, जब हमारा हार्ट ब्लड पंप करता है तो रिथमिक एक्सपेंशन और कॉन्ट्रैक्शन ऑफ द आर्टरिया विच जिसकी वजह से रिजल्ट ऑफ द पंपिंग एक्शन ऑफ द हार्ट, एक्सपेंशन कॉन्ट्रैक्शन पंपिंग एक्शन ऑफ द हार्ट की वजह से होता है. और particularly the left ventricle is responsible which ejects blood into the aorta and arterial system. So this is the simple definition of the pulse. It is commonly felt at the superficial arteries such as radial artery at the wrist. Now let's see the physiology of pulse. So origin of the pulse, how pulse is being originated. So the pulse wave originate from contraction of the left ventricle. So as we have seen earlier, pulse wave तब origin होता है जब हमारा left ventricle contract करता है. left ventricle को जब contract करता है उसे ventricular systole भी कहते हैं. When the left ventricle contract, it ejects blood into the aorta with force. जब left ventricle contract करता है तो ये blood को send करता है aorta में. This causes the elastic wall of the artery to expand and create a pressure. ये cause करता है इलास्टिक वॉल ऑफ द आर्टरिया टू एक्सपैंड. आर्टरी वॉल हमारी एक्सपैंड होती है और क्रिएट करता है प्रेशर. नाउ इट्स अ ओरिजिन ऑफ पल्स एंड हाउ द पल्स इज नाउ ट्रांसमिटेड. तो दिस प्रेशर वेव्स ट्रेवल अलॉन्ग द वॉल ऑफ द आर्टरीज. तो ये जो प्रेशर जनरेट होता है ये वॉल ऑफ द आर्टरीज तक ट्रेवल करती हैं. द स्पीड ऑफ ट्रांसमिशन इज फास्टर देन द एक्चुअल फ्लो ऑफ द ब्लड. द वेव इज फेल्ट एज थ्रॉम्बिंग सेंसेशन एट द सुपरफिशियल साइट वेयर an artery crosses a bone. So we can feel the radial artery at wrist, at carotid artery in the neck. Now let's see the factor influencing pulse. So these are some factors like stroke volume, amount of blood ejected per beat. If stroke volume is being altered, then stroke volume will also be altered. Elasticity of the arterial wall, more elastic, smoother pulse. Cardiac output, heart rate into stroke volume is cardiac output, and if cardiac output is altered, pulse rate will also alter. Peripheral resistance, so peripheral resistance में narrower artery, harder will be the pulse. So now let's see some more. So factors affecting pulse like age. न्यूबॉर्न पल्स इज़ वेरी फास्ट. जो न्यूबॉर्न बेबीज़ होते हैं उनकी पल्स बहुत फास्ट होती है. चिल्ड्रन ग्रेजुअली स्लो एज दे ग्रो. जब वो चिल्ड्रंस दे बिकम चिल्ड्रंस तो ग्रेजुअली स्लो डाउन होती हैं. एंड अडल्ट नॉर्मल रेंज इज अचीव्ड एट 60 to 100 beats per minute. एंड इन ओल्डर अडल्ट्स पल्स may slow down due to reduced heart function. And so this was about age. And like sex, women generally have slightly higher pulse rate than men. Women's का pulse higher रहता है than men's. Body temperature like fever, hypothermia, increase pulse rate. Like we have seen in when we have fever तो हमारी pulse increase हो जाती है. In hypothermia, decrease pulse rate. जब हम hypothermia when we experience, there our pulse rate decrease. So exercise and physical activity also affect, like immediate effect, increase pulse due to higher oxygen demand. Long term, like athletes reading pulse decrease bradycardia because of strong cardiac muscles. Now we have emotions and stress like anxiety, fear, anger, pain increase the pulse. Stimulation of the sympathetic nervous system. Relaxation, medication decrease pulse. Now let's see how medication affect. Stimulants like caffeine हो गया, adrenaline हो गया, atropine increase करता है pulse rate. Depressants like beta blockers, Dixogen decrease pulse. So blood volume and hemorrhage. Let's see. Hemorrhage, low blood volume, shock, bleeding, dehydration, pulse become rapid and weak. And how posture and position affect. Standing or sitting up suddenly may temporarily raise pulse. Lying down, pulse is gradually slightly lower. And in physical condition and fitness, well trained individual lower resting pulse due to effective heart function. Now let's see how altitude and oxygen level is also affected. High altitude और लो ऑक्सीजन हाइपोक्सिया इंक्रीज पल्स टू मेंटेन ऑक्सीजन सप्लाई। जब हम हाई अल्टीट्यूड पे रहते हैं या हमारे बॉडी में लो ऑक्सीजन रहता है तो हमारी पल्स इंक्रीज रहती है ताकि ऑक्सीजन का सप्लाई मेंटेन रहे। हार्मोनल इन्फ्लुएंस लाइक थायराइड हार्मोन लाइक हाइपरथायरॉयडिज्म, टैकीकार्डिया, हाइपोथायरॉयडिज्म एंड ब्रेडिकार्डिया। मींस हाइपरथायरॉयडिज्म में टैकीकार्डिया हो जाता है, रैपिड पल्स, एंड हाइपोथायरॉयडिज्म में ब्रेडिकार्डिया हो जाता है। So adrenal hormones like epinephrine, norepinephrine increase pulse rate. Now let's see. So if in more detail we can say trachycardia तो rapid heart rate हो जाती है, and hypothyroidism में bradycardia में slow down heart rate. And adrenal hormone epinephrine and norepinephrine increase pulse. Illness में fever, infection, heart disease, respiratory decrease may increase or alter rhythm of pulse. So now let's see the characteristics of pulse. So rate, rhythm, volume, tension and equality are the main factors that are the characteristics of pulse. And ये एग्जाम में पूछा जाता है, mark it important. Characteristics of pulse is been asked many times. So let's start. Rate, number of pulse beat per minute. So normal range क्या होती है 60 to 100 beats per minute. In trachycardia we experience due to fever, anxiety and exercise. And in bradycardia, decreased heart rate, that is when we sleep, train athletes and heart block. And rhythm, the pattern of beats and intervals. So regular rhythm, so we have equal interval between beats, and irregular rhythm seen in arrhythmia, that's atrial fibrillation. So how volume are the characteristics? So the strength of pulse wave depend on the stroke volume and arterial wall condition. So this is how volume is the characteristics. Bounding pulse होता है, like high volume fever में, hypertension में we have high volume pulse, and weak 3D pulse when we experience low volume like shock हो गया, blood loss हो गया, and tension force required to obligate the pulse by pressure. High tension pulse hard to compress, hypertension, and low pulse is easily compressible, that in shock. And equality, how is this? Pulse should be same on both the side of the body. So this is all the characteristics of pulse, that pulse should be same on both side of the body. Inequality may indicate arterial obstruction or localized disease. Now condition of arterial wall, it is a healthy person, the artery is smooth and elastic, and in arteriosclerosis artery feels hard and thin. Arteriosclerosis is the condition in which जो हमारी blood vessels होती हैं वो blocked हो जाती हैं due to fat accumulation, lipid accumulation, calcium, जिसके जो hard हो जाती हैं, एंड ब्लड का वहाँ से फ्लो करना डिफिकल्ट हो जाता है. सो इट ऑल्सो अफेक्ट द, इट इज़ ऑल्सो द कैरेक्टरिस्टिक्स ऑफ पल्स. वॉल्यूम ऑफ वेसल्स लाइक इंडिकेट्स द वेदर द आर्टरी इज वेल फिल्ड विद ब्लड और नॉट. फुल पुअर फिलिंग, डिहाइड्रेशन, शॉक एंड hemorrhage. Now let's see factor affecting pulse. This we have already been discussed. So now let's proceed with pulse assessment. Site for assessing pulse. So pulse is usually assessed where an artery is superficial and lies over a bone. जहाँ पे आर्टरी हमें आर्टरी superficially ऊपर से ही visible होती हैं over the bone, वहाँ से हम लोग लेते हैं. So mainly these are the sites of taking pulse like radial artery, brachial artery, carotid artery, temporal artery, femoral artery, popliteal artery and posterior tibial artery. R3. Dorsal pedalis artery and apical pulse. For better understanding, see temporal हमारे यहाँ पे होती है, temporal pulse हम यहाँ से ले सकते हैं near our forehead. एंड कैरोटिड, ये जो हमारी नेक है यहाँ पे हमारी अगर हम फील करते हैं तो हमें एक आर्टरी पाल्पेट होती है, यहाँ से हम लोग कैरोटिड ले सकते हैं. एंड एपिकल, इट इज़ लोकेटेड समवेयर हियर. एंड ब्रेकियल फ्रॉम आर ब्रेकियल आर्टरी. रेडियल, दिस इज़ मोस्ट कॉमन एंड हॉस्पिटल में मेनली हम लोग यहीं से लेते हैं. फीमोरल नियर द ग्रोन एरिया, वी कैन सी इट हुआ. पोपिलिटियल, सी इट इज़ ओवर हेयर. एंड डॉर्सालिस पेडालिस इज हेयर. And posterior tibial is over here. So these are the sites of taking pulse. Yeah. Okay, this is discussed. Now let's say radial कहाँ होता है? At the wrist, most common as I shown you. Brachial artery, inner side of elbow for BP measurement and infants. Carotid artery, neck के पास लेते हैं during cardiac arrest. Temporal artery, side of the forehead. Femoral artery, as I told you, at the groin area. Popliteal artery, behind the knee, and posterior tibial artery, behind the ankle. And dorsalis pedalis artery is ऑन द टॉप ऑफ द फुट। ये मोस्ट कॉमनली एमसीक्यूज में पूछ लिया जाता है। डोर्सालिस पेडालिस कहाँ पे लोकेटेड होती है? टॉप ऑफ द फुट। एपिकल पल्स, तो ओवर द एपेक्स ऑफ द हार्ट, फिफ्थ इंटरकोस्टल स्पेस, मिड clavicular line, taken with stethoscope. Now let's see equipment needed. We need a watch, clock with a second hand, stethoscope for apical pulse or in infant or irregular pulse, pen and chart for recording. Now let's see the techniques of pulse assessment. So for it we have to peripheral pulse, for that we have to wash and explain the procedure to the patient and ensure patient comfort. Then we have to locate the artery, that radial pulse at the wrist. Then we have to place pads of index, middle and ring finger gently over the arteries. Never use the thumb because it has its own pulse. We अपने three fingers से ही हमें pulse लेना रहता है. We never have to use our thumb because it has its own pulse. Now count the pulse for 30 seconds and multiply by 2 if regular. अगर pulse हमें regular feel हो रही है तो हम 30 seconds के लिए लेंगे and multiply by 2 से कर सकते हैं. अगर irregular we are experiencing then count for 1 full minute if irregular. So assess the record rate, beats per minute, rhythm, regular, irregular, volume, strong, weak, steady या bounding. Okay, now let's see alteration in pulse. So this is very important topic. Pulse may vary in rate, rhythm, volume or quality due to physiological or pathological conditions. So pulse may be normal or normocardia 60 to 100 beats per minute in adults, tachycardia more than 100 beats per minute like in fever, anemia, exercise in hypothyroidism, and bradycardia less than 16 beats per minute, athletic sleep, hypothyroidism, increased intracranial pressure and heart blocks. So thank you for watching and we will be continuing this part in our part 3. Till the time stay tuned and thanks for watching. And if you found the video helpful, do like, share and subscribe.